Now, moving on to some health discussion. The importance of sound health cannot be overemphasized as we focus on low sperm counts and its risk factors with Dr. Darwin this morning, Avar, aka Sabi Doctor, who is an award-winning health educator who leverages on social media to promote health literacy and positive health behavior change. Good morning.
Good morning.
How are you doing this morning?
Very awesome.
Now let's get right into this interesting conversation. Okay. Did you pick this topic as due to, based on statistics, yeah, there is an increasing rate of male infertility at the moment. Is that why you chose to discuss this topic, because you think it is a pertinent issue?
Yes, that's one of the reasons. The other one being that, you know, when you narrow it down to the causes of male infertility, low sperm count is actually the leading cause of male factor infertility.
Now, educate us on what low sperm count is for those who really do not have an idea of what it is. And for men who have it and don't know that they have it, how can they identify it?
Okay. So low sperm count essentially is defined as having a medical condition where a man has a sperm concentration that is below the normal limits required to make a pregnancy happen, other things being equal. And quantitatively, when we say a man has low sperm count, he has a sperm concentration of about less than 15 million per millimeter of semen.
So what is the standard?
So the standard is between 15 million per millimeter of semen up till about 250 million per millimeter of semen. Or you can take it as, you know, between 39 million, upwards of 39 million per ejaculate. So there's a difference between per millimeter and per ejaculate. Per ejaculate, you're taking the entire volume of semen. So a man ejaculates, you take the entire volume of semen. If you do the sperm count and it's in excess of 39 million sperm cells, then yes, that is within the normal range. So from 39 million up until like 900 million, okay, that's the normal range. If it falls below 39 million, it is considered as low sperm count. Alternatively, you can look at the concentration per mil of semen. So instead of taking the entire volume of semen, you just take 1 mil of semen, then you ascertain the sperm concentration. If it is below 15 million sperm cells, it is considered as low sperm count. Having said that, there are, you know, degrees or severity to, you know, when you're talking about low sperm count. There is a mild form of low sperm count. There's also the moderate form and the severe. Mild form is when the sperm count is less than 15 million, but above 10 million sperm cells.
And they're still within the, you know, capacity to procreate?
Well, the thing here is, while mild low sperm count can facilitate a pregnancy, bearing in mind that there may be some difficulty, by the time you are getting to severe, it becomes excruciatingly difficult. At that point in time, perhaps the man will have to resort to IVF or alternative artificial methods of facilitating conception.
Now let's just dig right into when does a man, how does he know? What are the signs? Because there are a lot of men right now who have low sperm counts and do not even know that they do have it. So what are the signs that a man should look out for?
So the thing here is the signs will actually depend on the symptoms, all right? I mean, on the cause now, whatever it is that is causing the low sperm count. Because sometimes people have low sperm count without realizing it. It's not as if you are having testicular pain that, you know, draws your attention to it. You can just be there until you actually try fathering a child and experience difficulty, then you have to go do your sperm analysis and discover that you have low sperm count. That said, oftentimes, depending on the cause, for example, a man who has hormonal imbalance, for example, the testosterone is low, all right, can also experience problems with the erection. Okay, so that might be a pointer to the fact that, you know what, there's some issue with my fertility. He goes there, does the test, and discovers that the sperm count is low. Or it could be a case of infection. All right, sometimes infection can colonize the testicular tissue. For example, it could be staph infection can actually colonize testicular tissue and cause some degree of low sperm count. So it actually depends on the cause.
Now,
yeah.
Let's talk about the risk factors.
Yes.
There are so many myths, first of all, surrounding low sperm counts.
Yes.
First, one of them I know of is, as a man, you're not to put your laptop on your laps, on your thighs while making use of it. There's alcohol. There is so you just take us through.
Okay,
some of those risk factors.
Let me start right away with the whole laptop thing. So one of the risk factors of low sperm count, which also can be seen as a risk factor for male factor infertility, is overexposure of the genital area to heat. Now, there is a reason the testicles are hanging outside of the body. God could have decided that, you know what, few testicles stay up there in the abdomen, don't come down. But the testicles are hanging outside, and there is a good reason for that. The temperature, the core temperature of the body is 2 degrees Celsius higher than the testicular temperature. If you take the testicles up there, or you expose the testicles to too much heat, it will affect sperm production, which is why people who use laptops for long without having like a barrier to absorb the heat, are prone to having, challenges with a sperm count. In fact, it is not only laptops as well. People who ride bicycles or horses for long distances.
Wow.
The study established that people who ride bicycles for a distance longer than 160 kilometers are actually prone to having some degree of sperm abnormalities. That's that. Again, people who engage in long distance travel, truck drivers,
wow.
The whole heat coming from that vehicle can affect, so these are some of the factors, questions we ask when they come to us.
Okay, can we quickly just, briefly just tell us, just give us a list of, risk factors and then things that people need to,
okay,
need to
so
look out
where
for.
Risk factors are mentioned: overexposure to heat, obesity. If you are obese, you are more likely to have low sperm count, poor dieting, all right? So that's where the whole sugar thing, excess intakes of sugar has a negative effect on testosterone. That can affect it. Smoking, cigarette smoking, even weed as well, can affect sperm concentration, though that is still a bit controversial. Studies have been done on that. So yeah, those are those. Then, of course, you have other causes as well, where it could be a case of infection, varicocele, hydrocele. These are all things that can affect the man's sperm count.
All right, thank you so much. I'm sure that everyone watching today has been enlightened. You definitely have to. You heard Dr. Avar. Please, some of the factors that he's listed out, look out for them. Thank you so much, Dr. Avar. And I'm sure the conversation...